Welcome to our presentation on forensic nursing. This will be a brief overview including career choices and education pathways to become a forensic nurse. Looking at a brief history of forensic nursing, we'll go over who founded it, when did the first education program start, and when did it become a career field. In 1982, Virginia Lynch discovered the importance during her clinicals of having nurses be trained in maintaining forensic evidence. This led to her creating the first program in Texas for forensic nursing and training for how to become one. Not only did she start training nurses, but she founded a curriculum that would eventually spread to other schools and programs around the nation. As mentioned before, the first master's program for forensic nursing was founded in Texas in 1986. However, it wasn't until the 1990s, 1992 to be specific, at a meeting in Minnesota, that forensic nursing was finally defined as a career field for nurses.
You might be asking, what is forensic nursing all about? Have you spent hours binge watching crime shows such as CSI Investigation, Forensic Files, Law and Order, or medical shows, and you were very intrigued by all the science behind it? Or perhaps you're not sure whether to choose a career in law or healthcare? Well, you don't have to choose between one or the other anymore. Nursing could be the career choice you've been looking for this whole time because it involves elements of investigation while applying a lot of healthcare and nursing skills. Forensic nurses are the link between the healthcare system and the law. They're the first point of contact between the victim of crime and the healthcare system. And they will also practice as children and adult psychiatric clinicians and medical legal consultants. By choosing this career path, you could be working with hospitals, prisons, and the law enforcement in order to collect and transcribe evidence while also acting as an aid in a crime scene investigation. In addition, forensic nurses are essential in providing expert testimony in court to assist in convicting criminals. You will be directly collecting evidence of victims of rape, sexual assault, domestic violence, homicide, pediatric trauma, human trafficked, and many other violent crimes. As a matter of fact, violence is the usual root of all forensic nursing cases, and your victims can either be children, adults, or senior citizens. This profession requires you to have a deep level of caring and compassion. Here are the main job requirements for a forensic nurse. You need to maintain confidentiality and compassion at all times, identify and preserve medical evidence such as blood, tissue, and semen samples, evaluate and document the patient's wounds and injuries, superb counseling, manage the victim's emotional trauma and fear, ability to calm victims, testify in court, and be an expert in the criminal justice system.
So you want to be a forensic nurse. You've done all the research and decided that this is the job for you. Here's how you do it. Step 1, become a registered nurse. This one seems pretty obvious. It can be an associate's degree or a bachelor's degree. It all depends on the program you were looking for. And of course, you have to pass the NCLEX, so good luck. Step 2, clinical experience. Most jobs will require at least 2 years of experience before you can be considered for a forensic nursing position. Typically, there is not a required specialty to work in, but some employers prefer a background in units such as emergency, med-surg, or psychiatric nursing. Step 3, research. Job availability will vary from state to state, so you're going to need to find the agencies responsible for hiring forensic nurses depending on where you live. This can be local hospitals, police departments, public health offices, or even universities. Once you figure out what job opportunities are available to you, then you can get an idea of what the requirements will be to apply. Step 4. Education and training. After discovering who employs forensic nurses in your area, you can then start looking into what their requirements are. Contact the State Board of Nursing where you live for more information. Each agency has different levels of training preferred or required. One of the most common requirements is the SANE, or Sexual Assault Nurse Examiner certification provided by the International Association of Forensic Nurses. You can visit the IAFN website for more details. There are some colleges that offer forensic nursing programs and similar certifications. These can include courses such as Advanced Health Assessment, Advanced Pathophysiology and Pharmacology, Forensic Approaches to Blunt Force Trauma, Forensic Investigation of Injury, and many more. There are many resources that you can utilize to become a successful forensic nurse. You just need to discover which one best suits you and the area in which you wish to work in. Step 5. You are now ready to become a forensic nurse. Happy job hunting!
Forensic nurses can work in a variety of settings, including hospital work, but beyond that as well. Most commonly, forensic nursing is thought of in the hospital setting. They aid in patient care revolving around situations of violence, crime, and human trafficking. This is thought of most often in situations of domestic violence and child abuse. Specifically, they may be working as forensic nurse examiners, or FNEs. These are the nurses that help these victims of crime, and they're often trained as SANEs, but it isn't necessarily required. These nurses do more than just work in the hospital, but they can also act as liaisons for child protective services and assist law enforcement and legal teams in the incidents of violence and crime. Forensic nurses can also work as nurse death investigators, called NDIs, or nurse coroners. Usually these NDIs earn a certification through the American Board of Medical Legal Death Investigators. These forensic nurses work in the death investigation process. They can pronounce and confirm death, establish the identity of the deceased, and notify the families. Like other medical examiners, they investigate the deceased body as well as investigate the crime scene of death. In this realm, they can work closely with law enforcement, social services, and other related agencies. Forensic nurses can work as forensic psychiatric nurses or forensic mental health nurses. They often work with crime offenders and crime victims. They can work in prisons or psychiatric institutions with inmates or patients that are suspected to have mental or behavioral disorders. They also may work with victims of violence and work with law enforcement. Lastly, many forensic nurses can work as forensic nurse educators. They may go on to teaching or advocacy programs and education surrounding the field of forensic nursing and anti-violence outreach. They can also go on to work in the nonprofit sector as well to help victims.
What are there different roles within forensic nursing? Yeah, I think we'll go there. Are there different roles? Can you work at a hospital or at like a coroner's office?
Yeah, that's a great question. So in forensic nursing itself, there are several different roles. Most people think of the forensic nurse as a sexual assault nurse examiner.
Okay.
Within the hospitals or community setting. And in death investigation, you're typically at the city level or the county level or even the state level. There's an awesome nurse in Tennessee who works at the Attorney General's office and does a little fraud investigation. But in the medical examiner's office, it's within the county, and you can either be a death investigator, so you respond to the scenes, take the calls from the nurses from the hospitals or hospice, or there's another role for case management, which is a little bit what you would consider your typical case management job in the hospital, where you're following up regarding different services, different questions for the team in a sense. And then from there, there's also an aspect of quality assurance within the pathology or investigative division as well. So we in a sense, created those types of positions.
Now that we know what forensic nurses are, how they become forensic nurses, and what they do, let's look at some forensic nurses in action, nurses that are making a difference in their communities.
This past September, New York City's new sex crimes chief made headlines due to his background in nursing. The new sex crimes chief, Deputy Inspector Michael King, is not only an experienced police investigator, but he is also a forensic nurse with experience in collecting evidence and performing exams on patients in order to solve these types of cases. In 2000, King joined the force, and 5 years later, he became an RN, going to school and working in the hospitals in his off hours. He then went on to become a sexual assault forensic examiner and continued to climb the ranks. He will now be the head of the NYPD's Special Victims Unit, which deals with cases such as rape. In fact, during the first week on the job, King was at the hospital assisting with rape kits. Because most police officers have no experience with forensic nursing, they are not allowed in the room. In the past, the sex crimes unit has been criticized. However, King hopes to change the department for the better. Officers have all been trained in compassionate interview techniques called trauma-informed questioning, and private waiting rooms and interview rooms have been created. King also wants to have officers participate in sensitivity training as well, because he believes that the way a victim is treated by an officer on the scene can be the deciding factor on whether a victim wants to report and move forward with their claims. When asked about King, the deputy commissioner had this to say: "At SVU, he can combine his experiences of helping people in trauma, his knowledge of science, forensics, and investigation, and his sense of justice in a way no one else, at least no one else I know, could." Another forensic nurse making a difference for victims of sexual assault and human trafficking is Rachel D. Fisher. Fisher, who currently works in Houston, where sex trafficking is a growing problem, is no stranger to it. Fisher was born in Detroit, where her mother was a prostitute. She was in and out of the foster care system and ultimately fell victim to commercial sexual exploitation as a teenager. However, she survived and was able to go on to nursing school, where she found her purpose. Fisher does outreach to sex workers in the city and helps them to get help if they want it. Through her own struggles, she has been able to turn forensic nursing into a career where she can help victims both in person and through the legal system. Now we've seen the differences that forensic nurses can make. However, sadly, many hospitals do not have a forensic nurse, as there is a shortage in many places. In this video, we will see what nurse Yvonne Garcia decided to do about it.
On new at 6, it's National Forensic Nurses Week. It's a time that recognizes nurses who provide care for adults and children affected by abuse and violence. CBS 4's Jelani Martinez takes us inside a doctor's hospital at Renaissance, where the only forensic exam center in Hidalgo County is located.
Yvonne Garcia has been conducting forensic exams since 2009. Prior to being a forensic nurse, Garcia worked in the emergency department, where she noticed a need for someone to specifically care for victims of sexual assault and abuse.
There was no real help for them. They would tell them, "We don't have a nurse available to do the exam, come back tomorrow," or "Go home, don't eat or drink anything, don't shower, come back in the morning."
Garcia started the Forensic Exam Center at Mission Regional Medical Center, but Mission closed the program due to funding. Garcia didn't allow the program to end there. She reached out to Doctors Hospital at Renaissance to create a forensic exam center there, much to the relief of the district attorney's office.
We were happy that they stepped up to the plate and right away, got a group of nurses together and opened up this facility.
Forensic nurses help the criminal district attorney with evidence by collecting clothing, taking swabs from the victim for DNA, take photos, and also interview the victim for detailed information about the incident.
It's been hard. I can say I'm not the same person I was 8-9 years ago. I've been open to a whole different world. I don't think people realize this happens as much as it does.
DHR launched its Forensic Exam Center in February of this year and finds more and more victims coming forward.
I've noticed that our numbers also have increased, which isn't always a good thing, but I'm glad the awareness is out there more.
In Hidalgo County, Jelani Martinez, CBS 4, Valley at 6.